All right, all new at 7:14 on this Friday, an autopsy result of the former Patriots player Aaron Hernandez showed the 27-year-old's brain had an advanced stage of chronic traumatic encephalopathy, or CTE. Hernandez had been sentenced to life in prison after being convicted of first-degree murder, and he committed suicide in prison back in April.
Now his family is suing the NFL and the New England Patriots, saying the CTE led him to commit suicide. CTE is known for causing anxiety and depression. Dr. Javier Cardenas is a neurologist from Barrow Neurological, and he's joining us this morning to explain a little bit more and put this in context. A lot of parents will be watching Good Morning Arizona right now, and they're concerned about their young athletes and the risk factors of these chronic traumas.
Exactly. So we're always concerned whenever we see a case like this. And what happens is, of course, there's a single case about an individual who had some behaviors during their life, and then they're found to have CTE. And so the question is, did that change cause those behaviors, whether it's suicide, depression, or other erratic behaviors? The answer is we simply don't know at this time. There was a paper published just a few weeks ago looking at a large number of individuals, football players, and that is the one that found that 99% of professional football players had forms of CTE, and they were more likely to have a severe form, a grade 3 or a grade 4. Now, what's also interesting is they looked at high school football players that had died, as well as college football players that had also died, and they were less likely to have CTE, and if they did have CTE, it was going to be a grade 1 or grade 2. So that led to the conclusion that it had to do with more repetitive injuries, a longer course of injuries over the lifetime of the individual.
So what I read was that his advanced stages of CTE was compared to more like a NFL player or somebody in the age of 60 range. Is this something you think we might see more of at a younger age like that?
We indeed are going to see more of it as we discover it. There are interventions. We're trying to reduce the number of hits in all sports, but especially football. We're trying to reduce any contact during the week, and Arizona was one of the first ones in the nation, and other states followed. We're trying to make sure that after a concussion that people go through a proper rest and recovery period in an effort to reduce the possibility of both short-term consequences and long-term consequences.
So how does it impact behavior and recklessness or proclivity for addiction to drugs or alcohol?
So the how is what we don't know. But what we do know is that these repetitive head injuries lead to an abnormal deposit of a protein called tau. And the parts of the brain that they deposit in can affect behavior. And so we're really trying to look at that link and find out what the cause and the effect of that is in order to intervene. So for people who think they might have it, there are some things that can be done to help. So if they're having anxiety and depression, we can treat the anxiety and depression. If they're having headaches, thinking problems, there are treatments. We might not be able to stop the entire process, but we might be able to help them while they're alive.
So you know his family's probably going to say this is what led him to commit these murders, and now there's a lawsuit involved by his ex. If this were to go to court, is the answer just we don't know?
I think so, and obviously I can't speak to this individual case, but I can tell you they're also looking at other studies because one of the major concerns is, does it lead to thinking problems? And there was a paper released earlier this week looking specifically at living former NFL players, and they found that for behaviors there were more abnormalities if you started playing football before 12 than after 12, but also they did some thinking tests, some neuropsychological tests, and there were no differences. They actually did well on their thinking. So what we're seeing is we're seeing pieces of the puzzle coming together. They're not fitting all together quite yet, but we're learning more information about this and hopefully diagnosing it in somebody who's living and intervening.
Dr. Javier Cardenas, thank you so much for giving us some perspective on this interesting
It's always
my pleasure.
report.
Always nice hearing from you.
Thank you.
Thank you.
Let's head on